Hi, I'm Sean, and for today's episode, we're going to talk about addiction. We'll look at different types of addiction. We'll look at how addiction impacts the behaviors we have. We'll look at how addiction impacts the brain, and then we'll look at a couple ways to kind of get out of addiction as well. But overall, today's episode is addiction, different types of it, defining it, and then what we can kind of do about it. So sometimes a question that comes up when we talk about addiction is how come some people kind of get addicted to something and some other people kind of don't? And that's because addiction doesn't just impact, it's not just about the environment, it's also about genetics too. So with those two factors, with genetics and the environment, it depends on if we go over our threshold, which then can place the brain into an addiction. So a lot of times, sometimes, let's say somebody is born and they don't genetically have like a family history of addiction in their genes. It's going to take more from the environment and also from them to cross the threshold to become addicted to something. But somebody else who has, let's say, addiction in the family, and it kind of has been passed down from generation to generation, and they have that trait within them genetically, biologically, it's going to take a lot less from the environment to put them over that cusp. So for example, if we start from the baseline, let's say 0, 0, nothing's kind of going on, and we start from the base, when you're born, you're already kind of somewhere. Let's say addiction doesn't really run in your family, or it does, whatever it might be. So let's say, for example, addiction does run in your family. So if this is the base, so this is already filled in, and then this is the top to where we cross the threshold of becoming addicted to something. Well, if already genetically you're born here, it's just about this much more of the environment to put you over that top to make your brain addicted to something. And once that pathway is connected, it makes it a little bit more difficult because that road is shaped now. So there's one connection in your brain leading to addiction. So now to fight it or to get over the addiction or kind of be more mindful about it, it's going to take more energy because you've crossed the cusp. You've kind of gotten over it. But somebody else who doesn't necessarily have genetically addiction or biologically in their factor, and then let's say they're smoking, they're drinking, they're doing other things a lot, the environment might fill in a bunch, but because genetically they're not there, they never cross that threshold of becoming addicted to something. So really what we're emphasizing is once you cross that threshold of addiction, how it rewires the brain. And that's why, in kind of simple terms, why sometimes people get addicted to something and not. Now, there's obviously other factors besides genetics and environment too that we can kind of cluster together. There's trauma, there's modeled behaviors, there's family dynamics, there's a lot of other factors as well. But if we just look at those genetics, biological factors, and the environment, those two together, it's filling up the cup. And once that cup runs over and our brain crosses to the addiction side, it's a little bit difficult to kind of bring it back because that pathway has been so firmly connected. Why? Why is that though? Well, if we think about it and we kind of rewind a little bit and take a step back, when we mention the word addiction, sometimes what we think of is just substance use. It might be, smoking cigarettes, drinking, whatever it might be, like more hardcore substances and stuff like that. But addiction isn't just substances. Addiction can also be exercising, work, eating, sex, technology. Like there's a bunch of other types of addictions that happen. So really when we're kind of mentioning addiction, what we're talking about is something that becomes a part of the routine and impacts us either in ability to self-care, relationships, financially, kind of becomes more important than anything else around us. So sometimes we'll lie, we'll cheat, we'll kind of like do other things about it. So if I have an addiction to shopping, which kind of really affects me financially, I might put that first before other self-care items. So if the addiction is getting in the way of life, self-care, relationships, being able to kind of like independently take care of ourselves, life-threatening like physical attributes and stuff like that, our overall health, that becomes an addiction. So when we talk about addiction and why once we pass that cusp, once the cup overfills and we become addicted to something, why is it so hard or why does it become such a thing to kind of try to break it? Well, first let's define it, make sure we know that addiction isn't just substances. So now what we're kind of looking into, why it becomes a little bit difficult once a couple runs over and we become addicted to something, is addiction impacts that same throughout the brain, but impacts that specific part of the brain, which is really impulsive. So that's our main thing. It's impulsive. And addiction is something that we don't fully think through. It becomes such an automatic response. And if you remember in our earlier videos, the main part of the brain that's responsible for that is the amygdala. So remember how earlier we talked about traumas and other things like that? The amygdala is this part of the brain, right, that's very, very impulsive, and it tries to keep us alive. But it also tries to self-soothe us as well. So if I'm addicted to drugs, sex, shopping, exercising, food, whatever my vices, whatever I'm addicted to, the amygdala really, it's almost like wearing your favorite clothing. You're familiar with the touch, the scent, the feel of it and stuff like that. It's like your favorite blanket, your favorite sweater that you constantly want to wear. Well, the amygdala doesn't care if it's like 100 degrees out there or if it's 20 degrees. It wants to wear this sweater because it closes this loop, this kind of self-comforting kind of feeling to it. So it becomes, and when we talk about the amygdala, it's not just the routines and the behaviors, but there's also a chemical opponent to it as well. So that also kind of, it's a 1-2 punch that keeps the brain keep doing what it's used to. So because it becomes so intertwined in that primal basic part of the amygdala, a lot of times what the notion out there is that we can't necessarily extinguish an addiction. We got to kind of replace it with something else. And that's because if you have a pathway in the brain, like a road kind of going, if you just try to stop it, it's like a dam that kind of builds up. You're not giving it necessarily an outlet or another way to kind of go about. So sooner or later, that dam's going to break and we're going to go back to old behaviors again. So when we talk about addiction, how it impacts that amygdala, that 1-2 punch, it becomes a routine. There's chemical things about it. It becomes an impulsive behavior. We got to give it some sort of outlet to replace it. So if we want to, I don't know, whatever it is, quit smoking or something like that, we got to have another thing to kind of replace it with. So there's naturally whatever. Our society looks at good things to replace it with or bad things. But that's why sometimes you'll notice people who have substance or that kind of addiction may or may not, it depends, but replace it with exercising, or they may replace it with food, or they may replace it with another vice. That amygdala is a very strong part of our brain. Now, if we kind of expand a little bit more on the amygdala and we just talk about ourselves, typically when something happens, our go-to coping skills, if you remember it from the earlier videos, is to avoid something. So when something happens and it's a little bit overwhelming, we try to avoid it. How do we tend to avoid it? We either numb it or we distract from it. That's kind of our basic coping skills that kind of come about, and then we'll kind of build on those things. But so if we're avoiding something by distracting or numbing, well, more specifically, substances help us kind of do that. And so now if we look at something that isn't an addiction, but it's helping us cope with something, we kind of want to do it more and more and more. And so you can see with this factor of avoiding it through distracting or numbing, it kind of, if you kind of think about it, it goes into a social or an isolating activity. So if I numb to it or if I distract from it, I can kind of do that when I'm by myself, or I can kind of do that when I'm in a social group as well. So now other individuals have an addiction as well. It becomes all of us kind of gathering together and doing this, but we all exist together, but we're kind of numbing and we're avoiding and we're distracting from it. So shopping might help me distract from something that's very heavy to deal with. Substances might help me numb from something. Sex is a very impulsive thing, that primal part of the brain, remember? Not intimacy, but sex, that kind of primal part. That hits. So you can see how an addiction gets a little bit sticky or tricky because of that primal instinct, the patterns in the environment around us, and also our natural desire or want when something is too overwhelming to distract from it, numb from it, to avoid it. So when we're distracting, numbing, or avoiding something, it kind of also impacts our tolerance. And what I mean by tolerance isn't just a chemical tolerance to the substances. I mean the tolerance we have to uncomfortable emotions. So if I want to avoid, distract, or numb from emotion, and I keep kind of doing it, it's almost like I'm chipping away at it. And the minute a little bit of that sunlight of the uncomfortable emotion comes through, I immediately want to go to my coping skill that my brain knows works, and that's avoiding, distracting things. So what I mean by that is, if I am I know it's a common example, but if I am self-medicating with whatever it may be, alcohol, marijuana, substances, or shopping, sex, whatever it is, but let's just say I'm self-medicating through marijuana or drinking. Okay. I am saying that it's not a big deal. I just do a little bit of it because I feel stressed out at times and it helps me cope with it. Okay, fair enough. But we have to be mindful that if genetic is biological factor or not, and it runs into you, because now you're creating an environment and a patterns of behavior that fills up the cup a little bit more, right? So we have to be mindful about that. But rewind, take back. If I am smoking or drinking to deal with my stress, sooner or later it piggybacks off of other emotions as well and doesn't just become a coping skill for negative stuff. It can also become a celebratory something. I'm celebrating something. It's a good emotion. So I deal with my stressors by smoking or drinking. Okay, I get this stressed out and I decide to drink. I'm like really stressed out. Like work has been hectic and blah, blah, all this stuff. I decide to drink or smoke or whatever it is. Sooner or later, my brain kind of likes it and starts creating obstacles or things that I am biasly looking for. Cognitive distortions, which we'll get into in another video, but starts creating this outlet or this lens that sooner or later becomes, oh, I'm stressed, I need to smoke or drink. Then if you fast forward a little bit, even if your tolerance to stress has become less, you also start creating stressors if they're not there as well. So not just does your ability to deal with stress because of these ineffective coping skills decrease the minute you feel stressed, you want to go to these things. You also, when stressors aren't there, are actively looking for them to excuse or give a reason to go and behave in this certain way. And that can trickle down not just to the negative things, but also the positive things. A buddy got a promotion at work, or it's an anniversary for something, or to celebrate whatever it is. So I'm like, hey, let's celebrate by doing these things. So that response that was once a coping skill for an extreme emotion now has kind of hijacked it and become a coping skill for both extreme emotions on both spectrums of it. And then it trickles into the environment. So let's talk a little bit about what happens now to, I guess, erase or kind of take back or kind of retrack from addiction or whatever. So if we have an addiction, the important factors that kind of happen. So when we are trying to change something or extinguish or replace the addiction and stuff like that, what we kind of want to, well, first off, let me just say that the notion and the idea of wanting to change a behavior, to stop an addiction, to get help for it is huge. And that's a very something to hold your head up high about, the fact that we are looking even towards that. I would really kind of recommend and obviously say, consult with professionals, physicians, psychiatrists, and so forth when you are trying to necessarily extinguish or stop an addiction, because some addictions, there's really a chemical and a withdrawal factor that happens from it. So alcohol, heroin, whatever it may be, it's kind of like very powerful and it can be life-threatening. So some addictions, we really need to be monitored and watched by a professional as we are detoxing from the chemical. So we really want to be mindful about that and not just take it upon ourselves to just kind of quit cold turkey. Another thing I will mention is that the notion is when we are trying to quit, stop, replace the addiction, whatever it is, we really, really want to be mindful in setting ourselves up for success. So sometimes if somebody's addicted to something, depending on what it is, they can kind of tell themselves, well, I'm stronger than the addiction. I can get over it. I can do it by myself. I don't need any help or anything like that. If I really wanted to, I can just stop with it. So what we're really kind of doing when we say that, to each their own, but we're kind of thinking that it's a one-on-one fight, like I can take this person or whatever it is. But really with addiction, it's not a one-on-one fight. And it's not even just a fight that's like fair. That's just like you fight and then you go take a break and you come back and fight. It's a constant. So when you're at home, when you're at work, when you're at a social gathering, when you're at a work event, a function, whatever it may be, a gathering with family, whatever it may be, the fight's always there. So there's really no chance to take a breath. And it's not a fair or a one-on-one fight. You're kind of battling multiple things like what we talked about. So you're trying to rewire. So you're battling environmental things, biological factors, people around you. You're battling all of these triggers that want to lean you back and remind you that your cup got overfilled and you are addicted to something. So really, really, we want to look for medication management. We want to make sure that our environment is appropriate. We want to make sure we have social supports. When we're trying to battle something like an addiction, whether it's eating, drink, like substances, shopping, sex, whatever it may be, because whether we realize it or not, like whether it's a subconscious thing or it's in the front of our mind and we're being mindful about it, the cup is constantly being added to throughout our day. So a subtle example of this, just randomly that we can think about and stuff like that, is I might think I'm all right with my addiction, but I might be driving in the car and pass down roads or ATMs or something like that I'm used to kind of seeing and stuff like that. And I might not even pick up on it, right? Because we're exposed to a lot of things around us that we're aware of and a lot of things that just kind of just go in back of our minds. And that's the battle sometimes with addiction too. You can be mindful about it, but really the cup is being filled from the back and the front. So it's a little bit difficult at times to say that I'm going to do this on my own. So I would just recommend professional help, depending on the addiction. Talk to somebody, get some help. Obviously, there's life-threatening things that can happen just quitting a substance like drinking or heroin or something like that. Opioids, cold turkey. So be mindful about that and get the help needed. So if we think about those things, what I want to pay attention to and focus on when I'm quitting or stopping or extinguishing or replacing an addiction is I want to make sure that I set myself up for success. Social supports, the environment. I want to really stay motivated. So look at my reward systems and stuff. And I also want to keep being mindful about things. So this can look like a bunch of different things, but if it's trauma work needed in order to face the trauma, in order to be sitting with the uncomfortable emotion for longer, so that way we can battle it, then we talk about medications, we talk about different types of therapy. If it's a chemical kind of thing, whatever it may be, because a lot of times addiction isn't just about the activity, it's about other factors as well. So that's why we want a team or a network of people around us to kind of help us out. So that's where like AA, NA, CA, whatever it may be, Al-Anon for the family members and stuff like that too. We really want to just kind of be mindful and get some help there. Another kind of side note, because I did mention just before Al-Anon and stuff like that, which is for family members who witness somebody in addiction and stuff like that, is I don't want to get too much into addiction. There's got to be tons of great videos out there. Talk to professionals and stuff like that. This is just a startup for you to go seek professional help if you so wanted to. But addiction is so powerful that there's sometimes loved ones around us. I'm not saying enabling and stuff like that, but loved ones around us who witness us or live in the same household as somebody who has an addiction sometimes actually share common ailments that the person who's addicted to something has without even that person doing any chemicals or doing anything like that. Because stress is such a heavy factor that obviously impacts our guts, our brain, our body, and overall everything. So somebody like, for example, who's drinking and getting ulcers and stuff like that, somebody else who's not drinking, living in the same household as them, can actually also experience getting ulcers and other factors as well. Just because it's such we can get down deep into it and talking about like mirror neurons and how we kind of see our environment around us and we want to mimic it for like survival purposes, but just really the stressors that happen witnessing somebody with addiction and wanting to help them. But again, I just emphasize that addiction, when we're fighting it, it plays dirty, it's not a fair fight, and it's not a one-on-one battle, and it's a constant. So really, really just seeking the supports and the help out there is huge, because it's also about modeled behaviors as well, not just those things. That was our video about addiction. I know it was quick and we just kind of got into just some surface stuff about it, but hopefully it gives a nice overview of addiction for ourselves. And as always, appreciate you guys out there watching. And if you like the video, thank you so much. Until next time.